Let's see. Good afternoon, ladies and gentlemen. We're about to start. An apology for delays. As you can see, we have swapped the gadget with the minister. Minister is going to read like me, and I'm going to read like him. My name is Phaahla. I'm responsible for media relations in the National Department of Health.
Recording in progress.
Without wasting any time, I'm going to call upon or introduce our members of the panel. Today, we are joined by the Minister of Health, as usual. He's going to lead. We're also joined by the Deputy Minister of Health, Dr. Phaahla, Dr. Sibongiseni Dhlomo. And we're also joined by the Acting Director General, Dr. Nicholas Cripps. We'll also be joined by other scientists who will be assisting us as usual to make sure that they assist in unpicking some of these technical questions as usual. So without wasting any time, I'm going to call upon Minister Dr. Phaahla to take to the podium to lead the discussions. This is a media interaction session. It's not a media briefing. So today we've got enough time to engage with the media in order to unpack all these questions, because since yesterday, since we announced this, the new variant, we've been inundated with a number of media queries, requests for media interviews from local, national, international media. So we felt that it would be proper if we afford the media enough opportunity to raise all sort of questions they have regarding this issue of around the vaccination program, together with the variant that we have announced yesterday. So without wasting any time, I'm going to call upon Minister Dr. Phaahla to lead these discussions. Then we'll be able to take a number of questions today. So it's a media interaction session. So we're going to interact, discuss issues of common interest with the members of the media. So without any wasting time, I'm going to hand over to Minister to take the podium. Minister, over to you.
Well, thank you very much, Foster. Evening to everybody. Evening to Deputy Minister Dhlomo. Evening to Acting DG and other panelists. Well, thank you very much to the members of the media who are on the platform. We really just felt that we need to create this opportunity just again to reflect on the announcement of yesterday. We are aware of the fact that the announcement which was made by our scientists who are busy following up on the genomic surveillance of the COVID-19 virus has created some consternation, some panic, and some uncertainty. Now, this is expected in a situation of this nature, where we're dealing with, a moving target, one can call it that way. But we want to assure South Africans and other people elsewhere in the world that we believe that some of the reaction has actually, been unjustified. I'm referring here specifically to the reaction of countries in Europe, the UK, a number of other countries. I'm told that also a number of European Commission countries are also contemplating similar reaction. All that we did together with our scientists who make this discovery of the variant was basically to be in line with the norms and standards as prescribed by the World Health Organization, that as a world community, as we deal with this pandemic and any other world, the challenges of which any matter which challenges the world health as a whole, rather than just the individual countries, we should act with transparency. That's basically what we're doing, to say that our very able scientists were in the process of monitoring the genomic makeup of this COVID-19 virus have come across significant changes in the makeup of the virus, as they explained, that the mutations are always happening all the time. But when they pick up something which is of significance, then they come out to inform us, so that we can be able to inform the World Health Organization as an overarching body, and also our partners in the health sector all over the world. Now, all that has been unveiled by the scientists is the changes which they have found, and they've also indicated that from the preliminary studies, it does suggest that this virus may be more transmissible, and also that they were concerned about some of the changes. And I know that one of the issues which has been quoted as the major risk, which has led to some of the actions which have been taken by some of the countries in the north, has been the suggestion that some of these mutation changes on this virus may have the implication of not responding to neutralizing antibodies, either from natural immunity from the previous infections of the COVID-19 virus, or also questions as to whether neutralizing antibodies and other immune system, body immune reactions may be able to respond or neutralize this virus, including from the immunity which has been ignited by vaccination. Now, I want to emphasize the fact that at this stage, as our scientists were reporting, at no stage did they say that they've got evidence that, firstly, that this virus is more transmissible. They simply said that, just as it has been the case as other mutations which has happened, some of them have had the effect of being more transmissible without necessarily also meaning that in terms of its seriousness, in terms of having more impact in terms of the severity of illness. They did emphasize that this is very early stages in terms of the specifics of how this new variant is going to unfold. Now, that's why we are saying that the reaction of some of countries in terms of imposing travel bans and such measures are completely against the norms and standards as guided by the World Health Organization. At this stage, therefore, as South Africa, we want to assure South Africans that it's very necessary that, as we have been warned even earlier when this pandemic started, that we must do everything to protect ourselves in terms of the non-pharmaceutical interventions, but also that it has been proven over time that the vaccines which have been approved by various bodies, world bodies, including the World Health Organization, but also various regulators, reputable regulators, including our own regulator, the SAPRA, which is indeed very, very vigilant before they can approve any vaccines, that we were quite confident at this stage that the vaccines remain a major bulwark in terms of protecting us against these viruses. It's been proven over time, the various mutations which have happened, that the vaccines are very effective. We know that they are not effective in terms of preventing one contracting the virus, but they've proven to be very effective in terms of preventing severe illness, which may result in hospitalization and also getting a person ending up in ICU or even succumbing to the virus. So we want to emphasize the fact that the announcement about this variant and the risk which the scientists were showing was simply to say that this needs to be watched, but there is no indication and any suggestion at this stage that this mutation, this particular variant, will not be able to the severe illness as a result of infection by this particular variant will not be prevented by the vaccine. There is no such evidence. So we want to dispel any notion, as has been bandied by various commentators. We have had even some of the reasons given by some of the commentators from some of the countries which has imposed these bans, that it is as a result of that. But we can assure you that at no stage did the scientists who announced the discovery of this variant say that this particular variant will be resistant to the vaccines which are being utilized. So let me leave it there, because I'm sure members of the media have particular questions, so that we can be able to interact, having made the introductory remarks. Back to you, Foster.
Thanks, Minister. You don't have to switch off your camera because my camera is not working well. So before I take the first questions, I'm going to check with the Deputy Minister if he can make the few inputs before we can take to the questions. Deputy Minister?
No. We will support the Minister on the questions. Thank you very much.
Wonderful. I'm going to now start taking the questions as we've committed. The first questions is a mix of questions. Other questions are not necessarily related to COVID-19 and the variant that we have announced, but they are more still talking about health. So the first question, I'm going to quickly go through this. Just give me a minute. Just hold on. The first question is there a number whether the data becomes more reliable and predictable or accurate, precise as pertaining the sequencing values and 5 factors mentioned in yesterday's address in terms of transmissibility, vaccine protection, disease severity, reinfection risk, diagnostic. What do you also think of the fact that a country like Israel, or that in Israel with 2 shots, booster shots of Pfizer, people tested positive for this strain? Do you have preliminary results concurred with this new vaccine as far as evading the current lineup of this variant is concerned? The second question is, given the detection of COVID-19 variant, the one that we are discussing, can we have a clarity on whether vaccination centers...
Foster, sorry, before you proceed, the long question, the first one, I just want to check with our people who are more knowledgeable here, just to hear that they got your question. Can I just check with Dr. Crisp, with Andrew, whether he can, I think, I'm not sure whether Andrew and Ian, maybe. Can I just check with you if you got the question, if you would be able to help us deal with that?
Good evening, Minister. Happy to answer.
Okay, you can proceed, Foster.
Okay, thanks, Minister. The second question, given the detection of this variant, COVID-19 variant, can we have a clarity on whether vaccination centers are now accepting undocumented people who are in South Africa to vaccinate as measures to curb these infections? Can this be clearly communicated publicly? I'm going to take just a few questions, then allow Minister and the members of the panel to respond. Another question is, it is 35 days till New Year, and no, this one is not related to this. Let me take another question. Let me go there. It's a mix of questions, but I want to start with the ones that are more related to these issues under discussion today.
Yeah, Foster, can you check that one that comes from Christine Duplessis? I think about questions all related to the program. I've just seen it gone up here in the chat. It's a long list, but of relevant questions there.
Let's see. Because some of the questions are more related to placing of medical graduates, which will come back to them as soon as we are done with the questions that are more related to this. Just let me take a minute. Yeah, another question say, a suggestion is there, if there's not enough funding to sustain the government mandated service, perhaps program should be, oh no, this one is more related to the medical graduation. Looks like somebody has dominated this with the.
Pastor, I've sent you the questions from Christian Duplessis on your WhatsApp. Okay, let me read them from the WhatsApp. Let's see. Yes, I'm going to, although a number of journalists have sent more than one question, but in order to afford almost everybody a chance to have their questions read, I'm going to take only a few questions per person. So I'm going to start with this one from Christian Duplessis. What was said today at the meeting at WHO, with the WHO regarding this response? This is a question. What was said during the meeting during the WHO as far as this issue of variant is concerned? The second question, did you engage the UK and other countries about the travel ban that has been imposed on us? If so, which countries did you engage and what was their response? Another question, do you have any new information on how infection of this variant is and also whether more dangerous than previous variants? The last question that I'm going to read before I allow the minister and members of the panel to respond is, more information is coming out on this new variant being detected elsewhere, such as the countries like Belgium and Israel. So do you think it's unfair that South Africa has been singled out here? There's been a rumor of other countries being aware of the presence of this variant and keeping under the wrap. What do you think? I'm going to hand over to Minister and members of the panel to respond to these questions while we prepare the second batch of questions.
All right, thank you very much, Pastor. Let me just, firstly, I'll take a few and ask other panelists to come in. WHO meeting, well, I'm not aware of that. Maybe if acting DG or any panelist, I know that Tulio de Oliveira mentioned yesterday that the WHO would, as they do often, will allocate a name to the variant. That was the main issue. So I'll just, maybe if anybody in the panel is aware whether this, what is it Latin or Latin name, which is supposed to be allocated. I'm not sure, or Latin or Greek, I'm not too sure Latin. Whether this variant is more deadly than the others, I think I've already mentioned that as of yesterday, what the scientists who were reporting were indicating that it looks like it may be more transmissible because of the changes. But in terms of whether from more virulence causing more severe disease, that part, there was no indication of that. Now, as to the question of whether we think that because the variant has already been picked up in Israel and Belgium, do we feel that those who are taking action, specifically because of that in fact, that should be the reason why, as guided by the WHO from long, that it's really not an answer to try and, if a country through its scientific surveillance is able to identify a particular variant, it is a wrong approach to then ascribe that particular variant to a particular country, because at the end of the day, we don't actually know, as I think our two academics, the two professors, Richard and Tulio yesterday, also emphasized the fact that when you do pick up a particular variant in a particular country, you don't know where it originated. So and you don't know where it is by the time it's picked up in country A. You don't know where it started, and you don't know even at the time in how many other places in one country and in other countries, how many other places that particular variant is already existing. So the kind of knee-jerk reaction, it really doesn't make sense, because many of the countries which have come with this kind of draconian reaction are themselves battling with a fourth wave, with a high spike of, in fact, with more daily infection rates. I mean, we are talking about currently, we are concerned about the daily rise in numbers. Today, the report from the NICD indicates just around 2,800, which is indeed high from where we come from about 2 weeks ago, but far less than many of the countries in Europe who have a daily infection rates of up to 50,000, upwards of that. I was just seeing a report earlier today that between Germany and Austria, for instance, put together, share a daily infection rate combined of upwards of 100,000 new infections per day. So it really doesn't look scientific and in any way. So that's why we would insist that that kind of reaction is quite knee-jerk and panic and actually almost wanting to it wants to put a blame on other countries rather than work together as guided all of us by the World Health Organization. The issue of undocumented migrants, we had already started in terms of a provision to vaccinate undocumented migrants, but I'll ask Dr. Crisp to speak to that. Let me ask the question of whether we have been engaging, we have engaged the UK. There was not even time to do that, because as soon as the announcement was made about the variant, without engaging us further in terms of seeking further information, contrary to where we ended when the red list was lifted, where we had been agreement on engagement on any developments in this regard, the UK simply went ahead and imposed the restrictions without even engaging us. So that was basically a unilateral action without, before there could even be any engagement. Let me give over to Dr. Crisp and then also to other panelists to take up on the other questions.
Thank you very much, Minister. Good evening to you and to Deputy Minister. So yeah, just to expand on what you said about the undocumented migrants, we took some time to try and work out a system to record the vaccinations, because if you don't have an ID number, it's hard to track back to you for a second dose or to know what other medications you've had. And this is a medication, so we need to have a patient record. But a system was put in place where the health departments create the ID number, and where that number then and the environment in which the vaccinations are given protects those people from other authorities who may wish to arrest them or give them trouble, because this is a public health intervention, and we are interested in vaccinating everybody. So that system is in place. It is quite difficult to get to people who are undocumented. And not all people who are either migrants, even illegally in the country, or refugees are undocumented. Many of them do have documents, but there are also many South Africans who are citizens of the country who are undocumented for one reason or another. So it has proved to be more complicated than first meets the eye, but there have been 3 piloted projects which have gone well, and there are a number of non-government organizations who are interacting with us at the moment to roll out the vaccination to undocumented people. I also want to say that the first time that we knew that any country was going to place any embargo on us, from my perspective, from our office, was at 10:20 last night when I got a WhatsApp from someone in the British High Commission to apologize. And we didn't know at all at that stage. From our perspective, we think it's not useful and it's not constructive at all to do that, because all it does is it makes the countries where there are scientific capabilities less likely to report when they pick up something. It will get picked up at some point because all countries that are able to do the sequencing are reporting to a global standard database. So all cases, no matter where those patients come from or how the tests originate, are all from a scientific perspective available to everybody in the scientific community. Let me hand over to Professor Sane, as he was indicating he's happy to answer one of the questions. Thank you.
So again, good evening, Honourable Minister and members of the media. The question was posed on when the sample size of variants that are genotyped, when the number that are sampled, at which point in time would we be confident of this variant. Indeed, this is very accurate testing that is done by whole genome sequencing. We have random samples received from, particularly from Gauteng in this initial period, where the suspicion of a variant was identified in one of the private laboratories. That sample size now exceeds 80 samples genotyped. Overnight and during the next 48 hours, samples from around the country are being accumulated at the various genotyping laboratories of the CRISP Institute and the NICD. And those will then allow us to investigate whether the transmission of this variant has in fact moved across into other provinces. This is one of the measurements. The second measurement is that we have seen changes on the viral load testing platforms that in fact test for COVID, and that those changes are indeed being identified across the country. So we anticipate that indeed the variant has spread across the country. The additional element is that we are seeing an increase in case rates. So the virus is likely to be more transmissible and is becoming the dominant type, or being transmitted as the dominant type in the country. Now we are speaking of relatively small numbers identified. Although we are seeing a sharp rise in cases, we are still in the region of less than 3,000 new cases per day. I haven't seen the data for today, this will, we hope, doesn't actually rise more rapidly. But indeed, as we accumulate more patients and samples, then indeed this will become more and more confirmed. In terms of vaccine effectiveness, there is a indication of an increased percentage of the cases identified that are indeed due to breakthrough infections or within groups that have been previously vaccinated. This rate is higher than it was previously. We do not have any indication as yet that the vaccines are indeed not effective. In other words, let me turn that sentence around. We have every indication that the vaccines are still effective in preventing severe disease and or complications. The data, however, is small and early. So the identification of this variant was only this last week. And as most of you who have followed COVID for some time will understand, that the disease period and severity it goes on into the second and third week post-infection. And so we will need to monitor this going forward. In terms of hospitalization rates, we do have additional people hospitalized, but the overall impression is that vaccinated, the ratio of unvaccinated to vaccinated is 4:1 at this time. And so unvaccinated or people should still go out and get vaccinated. We are encouraging vaccination. So overall, we do think it's more transmissible. We do think that it has already spread quite widely across. Are underway within the laboratory, and we will have more more immunology and transmission work undertaken by the middle of next week. I think that was the questions that I wish to answer.
Thanks very much, Honorable Minister and fellow colleagues, Dr. Crisp. I'm going to now take the second batch of questions, which read as follows. Let me do. The question is from Zodidi. She says, "Good day, Minister. How does Minister feel about the travel bans? How does the Minister feel about the travel ban against 6 SADC nations, including South Africa? Do the scientists believe that the bans are appropriate to control the new variant?" Another question is, given the reaction from many countries or regions in imposing travel bans or restrictions on South Africa, is there a scope rather than hold back on making such announcements, or will the country continue to make announcements if and when the new variants of concern are identified in the interest of transparency? Another question from John Mayers reads as follows: how do we know the recent massive case of waves in Europe where the results of variants have got exported to Gauteng last week? Another question is, in other ways, where did the variant originate? Most likely in uncontrolled maelstrom in Europe's massive case waves where they don't do genetic testing. Another question reads as follows: could the minister clarify what he said about vaccine ability to prevent severe illness from this particular variants? Can the vaccines in South Africa be able to prevent serious severe illness from this variant, according to what the scientists know so far? I think this one was partly answered, but we can still touch on it. Another question, it says, I think you would like to know if the cases identified in the new variant in South Africa were the people who had been vaccinated or not. Those people who were detected to be infected by this variant, were they vaccinated before or not? Another question, the last two questions before I hand over to the panel. The case of new variant in Belgium is a patient that returned from Egypt, while the case in Israel, similar variant, is somebody who has returned from Malawi. Yet the international response is to ban travel from South Africa and surrounding countries. Might this variant be much wider spread than we know now? Are we the victims of high standard of research or tracking this in South Africa? I'm going to hand over to Minister and members of the panel to respond to this question before I take the next page. Over to you, Minister.
Thank you very much. The question of how we feel about the travel ban, whether it's appropriate, I think I'll just reiterate that we feel that it's actually a wrong approach. It's misdirected. It goes against, the norms as advised by the WHO. We just feel that some of the leadership of countries are finding scapegoats to deal with what is a worldwide problem. And as other comments and questions came later on, I did say that it is ironic that we are currently talking about a situation where in South Africa today, as already mentioned by Ian earlier on, that we're talking about small samples. We're concerned about rising numbers from the low levels of about 300 per day just over 14 days ago to where we are now approaching 3,000. It is a significant rise, but in comparison to some of the countries which are now reacting in this very draconian manner. I mean, we're talking about countries, as I've said, with infection rates of upwards of 50,000, 40,000, per day of new infections per day. So, I mean, we don't want to apportion blame, but I mean, just in terms of the way the virus moves as people move, in fact, I mean, what one of the participants who raised the question also mentioned, it is not inconceivable that it might be possible that this may have even arisen in those countries which have been even more liberal in terms of crowds with no masks, crowded stadiums, and so on. I mean, that's the choice which they've made. So we can't really say that it is impossible. That and as the other question which came and comment about the fact that the person who also tested positive for the variant in Belgium was returning from Egypt, and the one in Israel was returning from Malawi. I think that just goes on to say, as really correctly so advised by the WHO, this is really a worldwide, health emergency, which should be treated as such, as a worldwide health emergency, and we must work together rather than punish each other, because at the end, if we're going to be on a witch hunt of blaming a game, it's just not going to benefit anybody ultimately. Whether going forward we would consider holding back on information, that's not something we're looking at, because we want to be, honest players in the world. We want to make sure that we share information which is to the health benefit of not just South Africans, but also citizens of the world, that we must continue to share this information. So I think others were more like comments to say this could have even arisen from Europe. As I said, we didn't want to go that way, but because we understand that at any given stage, these mutations are happening all over the world, and as they arise, if your scientists make an observation that these are not insignificant mutations, but these are variants of serious concern, then they need to actually report on that. Now, in terms of on the vaccines, what we are saying is that, as has been indicated already, that the pattern still remains that people who are not vaccinated are contributing more to hospital admissions. It's still early days in terms of this particular variant, but already in terms of the small sample, which has been, which we can only comment on, even with that small sample, it's still 1 in every 4, one person who's vaccinated who can get admitted, compared to 4 who are not vaccinated. Now, I think again, Ian will respond to this, but I think he had already mentioned that there are breakthrough infections. There are, amongst the people who are getting infected, there is definitely, as has been the case with the previous variants, there is amongst them people who are vaccinated, but that's far in terms of severity. It might still be early days, but there's no indication that those who are vaccinated, as it's indicated that the majority in terms of hospital admissions at this stage are those who are not vaccinated. So it still indicates the fact that the vaccines are providing protection. But I think let me invite the other panel members. I'm sure there might be areas which I didn't cover adequately. Back to Acting DG, I'm sure you could request any of the other panelists also to come on. Thank you.
Sure. Thanks very much, Minister. So we are busy trying to get some information behind the scenes about what was discussed at the World Health Organization meeting today. Earlier in the day, I just got a message to say that they were going to promote this variant to a variant of concern, which means it will get a name, but we haven't heard yet about the name. I'm not sure if Professor Gray would like to say something about the work that we've been doing behind the scenes on the Ministerial Advisory Committee, because quite a lot of substantial work goes on there in trying to trace what's happening. Andy?
Thank you very much. Good evening, Minister, Deputy Minister, and members of the media. So every country is having to think about an appropriate response to this new variant. And without prejudging what is going to be decided, we are having to look at a range of public health measures. The first that's really important is that we know what does work. We know that public health and social measures are important, that physical distancing, better ventilation, mask wearing, the use of hand sanitizers is a very important part of our response. The second is to really encourage and make sure that there are no barriers to vaccination. And that is something that will be taken very seriously over the next few weeks. We've already seen the announcement of booster vaccinations for adults who are immunocompromised. So everything will be done to protect those at highest risk. The third is something that we could do on our own, and that is to be cautious about large gatherings, about being in crowds, especially where there's poor ventilation, especially indoors, but also outdoors, and to be responsible about the way in which we mix. And even before there are any decisions to tighten restrictions or to impose any additional restrictions, those are the sorts of things that we as responsible citizens can do to think about our health and the health of others and to act responsibly. Thank you very much.
Back to you, Dr. Crisp. I don't know if there are any other members of the panel who may want to comment or respond to any of the matters raised.
Yeah, thanks, Minister. I was wondering if Professor Sane wanted to add to what had been said.
So I would make two additions. I think that this debate on travel restrictions and variants, I do think that we have been punished for the wrong reasons. I think that the variants have been identified due to outstanding scientific work done by the various branches. It's multiple groups. It's Tulio de Oliveira, but it is also behind a big team of scientists doing the genotyping. They have identified this variant, but indeed we're seeing that it has already occurred or spread across a number of continents, and we'll see more genotyping data come out of the international collaboration. I think the second element is that we have a very important opportunity to look at vaccine effectiveness through the Sisonke program for healthcare workers. The study is underway. The agreement or consent in that study allows us to tie up the data from the vaccination point to all laboratory testing for COVID in the country to hospitalization. And so I would strongly encourage all healthcare workers to come forward and be vaccinated immediately. We know that healthcare workers stand at a much greater risk than the general population for their exposure to COVID and therefore their infection rates. They will, by participating in the second dose of J&J vaccine, they will help us define the vaccine effectiveness for the J&J vaccine, will help us understand how to roll out the boost as quickly as possible to other groups of the population. a strong emphasis on vaccination. This is the tool in our toolkit that we have available to prevent infection. And also, I would think a strong emphasis on gatherings such as sports events being related to people who have vaccinated. So I think, Dr. Crispin, Minister, that's my thought for the moment.
Thank you. Foster, do you want to ask some more questions?
Thanks. Yeah, we do have more questions, but before I read the third batch of questions, I want to check with the Deputy Minister if you want to add anything. Deputy Minister Dhlomo?
Yeah, thank you very much. So that I leave to the next engagement that the minister has asked me to do. But just to say, I was listening during the day on the interview that was done by Dr. Anthony Fauci, the US government advisor on this matter. But I did not want to pretend I understand it very well. So I asked one of our professors, Professor Glenda Gray, to explain to me what was Dr. Fauci saying in that sort of interview, where in fact she explained that yes, he's saying they are noting as US the announcement by the Minister of Health in South Africa. They are noting the announcement. They hope that they will work with us also through the WHO, and they are not really thinking it is time now to re-advise the US government to have a ban on us. So that's very comforting to hear that. So while we were chatting with Professor Glenda, then she had to request to get out of the call because Minister, they are still busy with the WHO meeting. So some of the callers were asking whether you do know the outcome as yet. I just want to indicate to you, not yet, because Professor Glenda Gray was telling me they are still engaged in the meeting, but it's comforting to know the US is not thinking of applying a ban on travel, because the information that we voluntarily brought early, honestly, is something that is needed in the world if you are in this world space, but it is not something that warrants a ban as yet from their side. Thank you very much, Minister.
Thanks very much, Deputy Minister Dr. Dhlomo. Yes, yeah, we understand that we have got other engagements that have to do with this webinar and the department. Let me take the next batch of questions. The first question is as follows, is from Amanda Watson from the Citizen. Minister, the World Health Organization decided, has the World Health Organization, WHO, decided on the new name of this variant yet? Second question, is government rethinking its stance on mandatory vaccination as the world closes its doors to the country South Africa again? Let me get another question. I've got a lot of questions. I need to summarize them. The next question is, does the international response towards implementing travel ban restrictions, otherwise, does it make it harder for the country and other developing nations to share the data and be more transparent with regards to data and getting researchers into the country to research new variant? Is it possible to react to data but not implement the restrictions? And how is one example to do while also protecting the humanity's health from the worst mutations? Let's go to the next question. Some of the questions have already been answered, but I'll see. Even in case this is not already on the minister's agenda, could we get a sense of the meeting with the WHO technical team, which was scheduled for today? I think this one was answered. Let's get more. A question. 1 minute. A question from Alex from Reuters. Could the minister please clarify what he said? No, this one is already answered. Let me go to the second question. Yeah, the another question is let's see. No, this is not related to what we are here for. Maybe I'm going to allow Minister and the panelists to respond to the question, the issue of the naming and the issue of rethinking the mandatory vaccination as the world is closing the doors to the country. I'm going to package another set of questions.
Well, first, I think on the naming, that matter had been dealt with. I think when you said that, Professor Glenda Gray said they were still in a meeting, it also has to do with this particular matter of the naming of the variant. Once they've classified it as a variant of serious concern, they will provide the name. Our position on mandatory vaccination, well, as from the ministry and department side, we have not really had any reason, just because of this development of a variant, to believe that there need to be a change. We still would, wish that more South Africans voluntarily come forward. But as we have said before, we would also want to encourage various players, various parties, various spheres of life and business to look at their own space in terms of particular rules and provisions which they can make, which can, make sure that there is an incentive for people to be aware that it's incumbent on all of us not only to protect ourselves, but also to protect others. So we would want to encourage institutions and various role players in society to continue, because the difficulty from the government point of view is that we largely provide essential public services. Of course, here and there might be scope where there's particular possibilities where it might be provided by the state, but maybe not being an essential service whereby particular obligations could be made in terms of accessing those particular services. So, but at this stage, we're still going to have a number of meetings of various structures of within government. But from our side as the Ministry and Department of Health, we have not come to a decision to recommend to government any kind of regulatory imposition of a mandatory vaccination from the state side, considering, as I've said, that we largely deal with essential public services. Indeed, the question of whether this kind of reaction by some countries, I think a number of commentators on this platform have said so, that it's a very counterproductive reaction, because what it says is, if you've got the capability to do genomic sequencing, or to can have a high level of efficiency in the analysis of diseases, because this is not only going to end up with COVID. We said, even during the period of HIV, which is still with us and which is also still a problem, that but in the early days, that part of the reason why people were not coming forward was because of shaming and blaming and victimization and stigmatization. Now, you can shame and blame individuals, you can stigmatize individuals, but you can also shame and blame, states and countries and nations. And if you do so, the impact is still the same. That are you now saying that even at the level of states, they must now, even their capabilities must be driven underground, so that when they pick up something, information which would be of benefit not only to their citizens, but to also other members of the world community, that now people must feel that it is a risk to actually disclose whatever you find. It's very counterproductive, and that's what we believe. I think there were only those Foster, maybe you could give us more so that other panelists can come forward and contribute.
Thanks, Minister. Another set of questions as follows. Are we considering stricter lockdown regulations at this stage? Have we recommended any form of harder lockdowns as we approach festive season, so that by the time we go for festive season, we'll be having the lockdown, the harder lockdown restrictions will be in place? Another question is, given that March is not yet known about this one. Yeah, given it's not known about this new variant, what is the department's plan to curb the further spread? Can we expect harder lockdowns again? Another question is, will South Africa take any retaliatory measures against the countries that have imposed bans? Is the country going to retaliate against all the countries that have imposed ban on the country? And get extra 2 questions before the panelists can be able to respond. Yeah, another question is, Minister, how many people who are inoculated are infected and have vaccine proven efficient, and why is South Africa placed on red list? Another question reads as follows: what should South Africa do in order to be removed from this red list? What is our expectation or plan to have us removed from this red list? The last question is, since the country has been banned for being transparent, what is the WHO saying about this transparency, which leads to punishment of those who are transparent, like South Africa? I'm going to take this a few questions and allow Minister and members of the panel to respond.
Minister, thank you very much. Sorry, I was muted. I would want more participation. I think the breakthrough infections, Dr. Crisp, I'll leave that to you and other team members. I think also, Dr. Crisp, I'll leave the question of the measures to prevent further spread to you. Stricter lockdowns, definitely not necessarily anything concluded. There's still going to be over the weekend, between tomorrow and Sunday, meetings of various structures of government, including what is called the net joints, which is heads of all departments, including the security cluster and communication and all the departments of state. They will be looking at that, and then the Coronavirus Council, made up of a number of ministers, and the president and deputy president would also meet. But from our side at this stage, we have, we are examining the situation. We will make some recommendations in terms of the fact that there is definitely, a spiking of infections. We will make some recommendations in terms of health measures, as already mentioned by other participants in the panel, that we know the measures which have worked, which do work, which is that of reducing crowding, both indoors and outdoors, and continued physical distancing, masks and sanitizing and washing hands, and especially the issue of crowding, especially indoors, but also outdoors in bigger numbers. Clearly, those are the issues which the various structures, including ourselves, as we make recommendations, we will be looking at. It's too early to say what level of reduction in terms of especially gatherings and those, but definitely I think just judging by what is the movement of daily infections from around 200, 300, maximum 4 to 5 to where we're sitting today at just under 3,000, 2,800. So it is a big jump from where we were about 10 days ago. So it will be necessary to take some precautions. As to exactly of what nature, to what extent, that is still to be discussed. And yes, I said I'll ask Dr. Chris to talk about just, some of the ways in which we do look at curbing further spread. Retaliation, not really something which, I mean, as much as I don't speak on behalf of whole of government, I know it's not our approach. So I don't expect, even when both the Coronavirus Council and also Cabinet does meet, I doubt if that will be the approach. We have never approached things this way. Only when in the first wave, when we did the hard lockdown, when there was a general stop of traveling all over the world, we also did that. But as an isolated move by ourselves, we don't think we'll be going that route. It's very unlikely. What do we do to be removed? Well, we'll continue, to engage. Now that this has happened, our doors open. We will invite all those who have taken this kind of steps to come back to the discussion and look at the logic, and of course also, hopefully bodies like the WHO will also assist in terms of just breathing a sober kind of air of consideration to those countries which have taken such steps. So we will engage with them. We'll engage with them just to show them the negative effect and the retrogressive nature of the kind of steps which they have taken, and hopefully with that they will be able to retreat in terms of this. What is the WHO saying? Well, I can just say that about 2 hours ago, I received a message from our regional director, the regional director for WHO African region, Dr. Moeti, who was expressing her own disgust as on behalf of the WHO at the steps taken by these various countries, saying that indeed they are counterproductive. And from their side as the WHO, they will engage them to show them that this is actually counterproductive. So so that basically what is coming out from the WHO. So their position is very clear that this kind of reaction it's actually counterproductive in terms of world solidarity in fighting the pandemic. Let me give over to Dr. Crisp and other panel members who may want to comment on some of the issues raised.
Minister, thank you very much. So if I could just ask the administrator to let Professor De Oliveira into the panel, please, so that he can also answer questions. He's finished a meeting and he's able to join us now. And then, Minister, I'm going to also ask Shital Silal, who's working with the Modeling Consortium, because I think it's very important that people understand that there's a whole lot of other work that goes on behind the scenes. She's been able to join us on the panel as well, and it's just useful if people are able to understand that kind of preparatory work that is going on, anticipating what's coming. And perhaps Andy Gray can add, because he's leading the discussion on the control and movement of people. We know that it is the movement of people that spreads the virus. And exactly what are the thoughts that go on in that environment and in that discussion of the Ministerial Advisory Committee. So rather than me answer, these are the people who are directly involved in those. If we can start with Shital, perhaps, and then we'll let Tulia in a moment to talk about what we know more. Thank you.
Thank you. Good evening, Minister, Deputy Minister, and members of the media. I'm Professor Shital Silal, and I'm a member of the South African COVID-19 Modeling Consortium. And this consortium is a group of infectious disease modelers who have come together from universities around the country, who engage in modeling at a population level, taking into account all the different aspects of the disease, from population behavior, along with how the disease transmits, and as well as the restrictions and the non-pharmaceutical interventions or public health social measures that are in place as well. And we put these all together in order to establish a set of projections or forecasts, as in some cases, as well as a set of scenarios on what the future may look like with respect to preserving hospital capacity, as well as for the spread of disease. And so the modeling consortium has now taken together information from reinfections analyses with respect to changes in the levels of reinfection in light of the new this new variant. We've also taken into account the rapid increase in cases, and we've provided a set of projections now at various levels of immune escape in order to see the impact on the health system. And so what we are able to show right now are scenarios showing the level of the hospital admissions, that if our immune escape variant is severe in its implication, as well as leading to a large degree of loss of protection, we could expect, for example, to see waves similar in size of our previous waves 2 and 3 under some scenarios. Under other scenarios, we are able to project smaller sets of waves. But one of the messages that is quite clear in all our projections so far is the impact of population contact behavior. And by that, what we are referring to is that in the coming months, as South Africa approaches its summer holidays, we are expecting to see increases of movement and increases in contact as there are more family gatherings and particularly movement within the country. And so with increasing contact behavior, what our scenarios are able to show us is that we could expect waves that have earlier and higher peaks compared to a case of where a public health and social measures are adhered to the same level as previous waves. And by that, what we mean is that there is no onward NPI fatigue or public health and social measures fatigue, and the same levels of strict protective behavior is maintained. And what we're also able to show in our scenarios, by taking into account the impact of the vaccinations and the ongoing vaccination program in South Africa, we were able to show in previously released sets of projections that the impact of waves that were beginning at a time when more vaccination was achieved was smaller in size, with lower peaks compared to waves that would be starting earlier at a point where we had not reached a substantial level of vaccine protection in the country. And so what these scenarios can tell us is they can inform the country's health planners as to what to expect in hospitals to prepare adequately, as well as inform the public on the impact of the protection offered from vaccinations as a nation, as well as the impact of maintaining strict adherence to public health and social measures over the upcoming holiday season. Thank you.
Thanks very much. If I can go ask Andy if he wants to comment on the movements to pick up on what Sheetal was saying.
Thanks very much, Dr. Crisp. So as Sheetal explained, some of the factors in these models we can't do anything about. The nature of the virus and the consequence of the mutations is something that's a given. There are other things that we can make a big difference to, and that is adherence to public health and social measures, and perhaps tightening those in order to reduce contact between people and therefore the spread of virus. So as the minister has explained, we are not in a position at this stage to make announcements or predictions of where we're going, but I think it would be remiss of the country if we did nothing. And so we can expect for at least some additional restrictions to be placed, but at all times, we are very aware of the potential economic impact and as well the impact on people's social lives and their acceptance of government intervention. So it's about balancing all of those factors and finding an appropriate and evidence-based approach to what can be done to reduce contact between people and therefore spread of the virus. Thank you.
Thanks very much, Minister and members of the panel. I've got the last set of questions, and they read as follows. Seeing that South Africa has access of vaccines, why not shorten the period, the waiting period between the first dose and the second dose from 6 weeks to 4 weeks after people have vaccinated, in order to prevent more spread or the loss of life? The second question is directed to Minister. Said, Minister, as a government official, especially in healthcare, we need to advise and advocate for robust vaccine mandate. This one, I believe you've answered it, but if you feel you want to emphasize on this, you can still come back. The third question is, which other countries have indicated they will institute further restrictions against the country? Is there any international protocol for deciding when to institute a travel ban against which particular country? The last question is read as follows. Let's see. Yes, Minister, this one is read as follows. Minister, you sound unhappy about the travel ban that has been implemented by the UK and other countries. Does it mean we won't have interprovincial and cross-border ban during the festive season? Yeah, these are the 4 last questions that I have, Minister and the members of the panel.
Okay, thanks, Foster. Well, the issue about shortening the period between the first and second dose of the 2-dose vaccines, I'll leave that to Dr. Crisp and others. My own input there just briefly would be that we will be advised again we've got a Ministerial Advisory Committee on Vaccination. The period we took was on their advice, but Dr. Crisp may want to add on that. The issue of vaccine mandate keeps coming. Let me just say to people on the platform and also to all South Africans that, we have a particular kind of approach coming from, as a country which came from impositions from, where in our history. So we do understand the reluctance to move in this particular direction, but it's an avenue which we're not totally, averse to exploring. It's a question of when that does happen, especially coming from the state, what is the kind of areas of entry in terms of mandatory for this particular activities and so on. It does look like, just listening to I've talked to a number of people who have given me their own examples of some of them at workplaces, what they needed to do, some time, and we're listening to this, and I think from the Coronavirus Council and Cabinet, they will rely on us, and I would invite especially colleagues from the health sector, but also other players in society, in industry. I know that even some human rights lawyers have actually come forward to say there is no unconstitutionality, because this is about public health, protection of the public, and it will be entirely protected within our Bill of Rights, because individual rights have got their own limitations when it comes to protection of public. In other words, protecting the rights of other members of society. So we're getting those kind of advices, and we look at it, I think, with our Ministerial Advisory Committee, both from the social side and also from the health side. On both sides, we would want to encourage them to give us really practical proposals in terms of how do we move forward in terms of this area. Any other country which is maybe indicated that they might be taking steps, We at this stage, we just hear that some members of European Commission might also be wanting to go that route. It looks like it's largely from that part of the world. Be outside Europe, we have not really had much in terms of that kind of an approach. And I think somebody is trying to preempt by asking, since we are not happy about restrictions from other countries, can we guarantee that there will be no restrictions on internal traveling as we go towards the festive season? Well, I wouldn't want to jump the gun. I mean, as our experts here have indicated, that movement is the one which moves with the virus. There might be some level of proposal on restricting some element of movement. So I'm not in a position to can guarantee that going forward, if the infection rates continue to rise, that as we look at measures to contain, that there will never be any limitation on interprovincial traveling for non-essential. I can't guarantee that. It's going to really depend on our risk-adjusted approach into dealing with these matters. But let me invite Dr. Crisp and others, as Foster indicated that we are now closing. They could also just comment on some of this, including whether we can shorten the interval between the first and second dose, and any other matter which other panelists may want to just, as in closing, just make those remarks. Thank you. Thank you, Foster.
Thank you, Minister. Thank you, Foster. So, Minister, just very briefly on the interval, we've had various debates about the interval and listened to the Ministerial Advisory Committee on Vaccines discuss this. Different countries have different intervals and they range between 21 days and 90 days. We settled on 42 days at a point where that was shown to be a very good immune response on that interval between the two Pfizer doses. Things do change, and there are also changes that may well come with the Johnson & Johnson vaccine. It doesn't increase the utilization of the vaccine by shortening the time period. All it does is you use the same amount of vaccine just in a slightly shorter space of time. But we have a lot of vaccine in the country. I thought it might be useful. I know we want to close, but we've got both Professor Rudo Mativa and Tulia de Oliveira have joined us. And I think it would be very good if Rudo might tell us from a clinical perspective at Baragwanath Hospital what they are seeing there at the moment. And then if we could get a last word from Tulia. He's been in meetings the whole day today with colleagues around the world, and it might be useful to get some feedback from Tulia on some of those discussions that have been happened before we close. Thank you. Rudo?
Thank you very much. My approach is from the clinical point of view, and that is what I advise on the Medical Advisory Committee. We have already seen a change in the demographic profile of COVID patients. We are seeing young 20s to just over late 30s presenting at our hospital with moderate to severe COVID disease, and some of them needing critical care intervention. Of note is 65% of those have not been vaccinated, and the rest have only been half vaccinated. So took the first Pfizer jab, and we're still thinking of going for the second Pfizer jab. I am worried that as the numbers go up, the public health care institutions are going to be overwhelmed. And I see no preparation in getting those institutions ready for a surge response. And that is one thing that we should also be concentrating on. We know we've got a new variant. We may be debating as to how it's gonna behave, but worst case scenario, it hits us as Delta hits us. And then we will have a problem with bed numbers. In terms of imposing restrictions, that ain't my field of expertise. And I think there are a lot of a number of people and ministries that would have to gather and discuss that and see when they should put in restrictions. But my 5 cents worth of it is when we get pressure on COVID beds and on critical care beds, getting the trauma ICU patients out of the picture really help ease the pressure on beds for COVID patients and for non-COVID patients. So that is something that we could look at. Yes, I understand the economy may be threatened, but we will still need people to live through this to be able to carry out the economy. I do agree with what has been said about the new variant, about countries giving us the red sign. And I do believe that they're being irrational. But we're caught in this net. And we just better figure out how to get out of it in a dignified manner. But let's look inwards. How do we manage the sick people that are going to come in? How do we attract those young people that do not want to be vaccinated to realize that they would want to be vaccinated now? Because that is where our strength will lie, when those young people come and be vaccinated. Then the pressure on the beds will ease off, because we'll see mild to moderate disease, or we will see people that don't get that sick at all. Thank you.
Okay, thanks very much.
Any other input from one of the panelists?
Yeah, Tulia, maybe it would be useful if you can tell us what's the discussion been in the global space in the various meetings you've been in today, just before we close off. Thank you.
Yeah, thank you, Nicholas Crisp. May I ask if I can put my camera on? I find it easier if people can see to understand. Yeah. So we have been the whole day in meetings. Yeah. Initially with our, we have a very large consortium of scientists in South Africa that really stop everything that they are doing to try to understand the most important questions about when a variant emerged, that involve transmissibility, reinfection, effect of vaccines on diagnostics and clinical severity. Yeah. And we had over 100 of the top scientists attend the meeting today, and many of them starting the work straight away. Yeah, so I think that at least we are blessed in South Africa with large number of committed scientists, so we can answer a lot of the questions, the very important questions in the next few weeks. Yeah, and that was followed with meetings. For example, we had an urgent meeting of the World Health Organization. Yeah, that's at very, very, very high level. We participate in what we call the Technical Working Group of Virus Evolution. That's the group that define what a variant should be, which classification system, which name, and what to look for and what to worry. Yeah. Most of the colleagues in that group were as concerned as us about the variant. Yeah. So on the scientific front, yeah, Many of them were very concerned about the mutations and the potential properties. So we are not alone on that. Yeah, and the WHO will do a press statement now or in the next hour or so. They are just finishing that they will give a Greek name to the variants. They only give Greek names for variants that are either of interest or of concern. Yeah, and they will highlight which category that will come, understanding that the variant of concern is of more concern than of the interest. Yeah. I am in confidential agreement with them, so I cannot discuss the decision, and that will be coming in the next few minutes or hour. Yeah, but what I can say is that many of the colleagues, and that involves some of the top scientists in the world from all countries, they were as worried as us about the constellation of mutation. One thing that became quite clear from that group, and the WHO already did a press release on that even before they do the release of the variant classification and name, is that most of our colleagues and the WHO itself at very high level, they did praise the South Africa about coming on this information very quick, because one thing that we learned from this pandemic is that taking decisions later and then early is normally have a lot of consequence. So we will know with hindsight in the next few months if the very quick detection of this variant, we are talking about days since emerge, detection and come public was the right decision. But what most of the scientists in the WHO say is that to try to get out of this pandemic, we have to act quick, and we have to act fast, and we have to act with all the data that we have. Yeah, I know that many of the public and are very upset with the reaction of the external world, including our minister and myself. I thought that was a knee-jerk reaction. Yeah, sometimes one gets punished for being transparent or doing things very quick. Yeah, it had some major statement, for example, from Gordon Brown, the ex-prime minister of the UK, highlighting that the reaction against South Africa is far too strong, and that would discourage other countries on when they identify variants with unusual mutations and high number of mutations to come forward. I think that we will have a lot of international solidarity. I know that a lot of time the discrimination is more than solidarity, and I do apologize that people took a very radical decision of even halt flights with a day that affect many people's lives. Yeah. And I personally and many of the colleagues have fight from the beginning against travel bans. We don't really find them effective. That's how the virus affected around the world. If you remember that the first country to do a travel ban on China was the United States, and end up with the highest number of infections in the world. So scientifically do not make that much sense. There is other ways, such as quarantine or testing or vaccination, but a lot of time people take decisions based on emotion, not rationality. Just why I got late for that, we had a special meeting with Dr. Anthony Fauci from the US, the NIH, and also the head of all the agents there, the head of the NIH that was organized by Professor Glenda Gray. And so they also offer the scientific support, and to see how they can help at higher scientific level to come with all the questions that we need to answer, especially on disease severity and vaccinations. One thing that became very clear from all these meetings with some of the top scientists in the world is that really important to increase the rate of vaccinations in South Africa, and also the public health interventions. This means testing, contact tracing, and isolation that have been very effective. Use of masks really reduce transmission by 50%. It's not the time to let the guard down and let super spreading events. And then really think about trying to control this viral early, with public health measures. of course, that lockdowns is only when you lose all the public health measures. So I think that we still have a chance to control this virus early. And I would like to plead for the journalists and the public to take very serious, especially in the next week or two, the super spreading events as we come to stop school and universities, to really try to take serious. We know how this virus start waves. Normally they come by younger population, that they are very sociable. It's normal, all of us when are younger, we're very sociable, and they start spreading up and then end up in really who get affected is the most susceptible population. That's normally the advanced age of comorbidities, So in general, it has been a very busy 3-4 days, And on the scientific front, we are really trying to do our work in the maximum speed with really great scrutiny of the data, and highlight the information to all the public health decision makers, and we really hope that the early detection can not only be bring bans to the country, but potentially scientific and financial support to South Africa. And we really hope that can really, really focus on decreasing this fourth wave. And of course, it is a very big risk as a scientist to highlight a variant early. And we have to leave one decision, but at the moment, my biggest dream, is that all these really concerning mutations that not only our team but the whole world have seen doesn't come to play out as the scientific community think. We really hope to be wrong, but it would be not good for a scientist, but would be otherwise would not be good for South Africa, especially for the health system and the people as we come to the end of the year. And as Rudo highlight, and many of our colleagues, our health workers are really tired, very exhausted, and we hope that we can control this variant and this fourth wave as soon as possible. Thank you, Minister, and thank you, DG, and apologies to arrive a little bit later to this meeting.
Thanks very much, Prof. Tulio, and members of and other members of the panel and Minister. Before I do the closure, I want to allow Minister to do a wrap up. The last part in short, Minister.
Thank you very much, Foster, and thanks to all the panelists. Indeed, it's always good when, as South Africans, when we are in a difficult situation, that we pull our resources, we work together. It's only in unity that we can be able to conquer. We're all going through difficult situations, and of course, it's always easy to take the shortcut, to take the easy way out. As I said earlier on, to try and assure the people you lead by just blaming others, by pointing fingers. But we know that that's really not a long-term solution, and whatever the implications we know, I mean, we knew from earlier on, and it's very clear that we are in a marathon. This is not a sprint. It's not something which is going to end tomorrow. We're going to have to pull together. And from our side as government, we listen, and the advices in terms of the further preparation, as Rudo was saying. I am with the acting DG here. We had a meeting with all the MECs and HODs yesterday, before to alert them before this matter went public. So we will be following up. We did agree yesterday that we'll be following up with further details in terms of strengthening the health platform in preparation for what is probably lying ahead of us, with the risk that, especially in this period, where in a few weeks' time there's going to be a lot of movement. I think in the next 2 weeks there's going to start to be a lot of movements in the country. So all those factors have to be taken into consideration. But thanks to everybody, we will depend on all the expertise, and also colleagues in the media. We also depend on you availing your media platforms so that information, credible information, can be transmitted to the public without any distortion. So until next time, thank you very much.
Thanks very much, Minister, and all members of the panel and members of the media for responding on a short notice. And I want to assure all the members of the media that we'll always try by all means to avail our technical people, our political principals for the interviews. Whenever they need us, we'll be there for them in order to empower our nation, empower our public to make well-informed health choice and vaccinate. On that note, I'm going to declare this media briefing adjourned until media interaction session until next time. Thanks.